Good morning, Koone County. I'm Dr. Michael Koone, Morrilton Medical Clinic. You've seen me on camera before. Larry Miller is hosting me. I'm also the County Health Officer for Conway County, Public Health Department of Arkansas. I'm going to bring another guest today, but before I bring this special guest on air with me, let me just update you since last week about new developments in COVID. Unfortunately, we're taking off like gangbusters once again. I think we're going to exceed the numbers we had last winter. And hospitalizations have already done that in many places in Arkansas. UAMS is now up to 75 admissions. Their peak that they reached last winter was 63. Arkansas Children's Hospital now has 24 admissions. 4 of these unfortunate kids are on ventilators. My guest informed me that one of her nurse practitioner friends who works at Baptist in Little Rock had apparently 148 visits or admissions last night. Incidentally, none of them were vaccinated. So Arkansas, unfortunately, ranks number 3 in the nation in new cases per 100,000 population. That puts us quite a bit of risk. New CDC guidelines came out yesterday, now advising affected areas defined as greater than 50 per 100,000 population return to universal masking. Arkansas, unfortunately, is way over 50 per 100,000. Every county in Arkansas is. So I'm curious to see what's going to happen with Act 22, the governor and the legislature, if they're going to perhaps rescind some of the bans on masks that they enacted, which is supposed to come into effect today, by the way. Let me tell you about Conway County, because we're interested in Conway County, of course. Our clinic, Morrilton Medical Clinic, is very liberally testing anybody that comes in with the slightest symptoms for COVID. If you come in with a runny nose, cough, cold, fatigue, congestion, diarrhea, headache, fever, you're going to get tested. I'm sure the other clinic in town is doing the same way. Our positivity rate now for Conway County, and these are for tests that are done at St. Vincent Hospital in Morrilton, our positivity rate is 25%. That's much greater than it was in the winter. In other words, for every 4 patients we send over there, 1 of them is going to be positive for COVID. We're dealing with the Delta variant, which is much more transmissible, contagious, infectious, and we think it's going to be more deadly just because of the sheer number of people that are infected than what we had last winter. Of interest to Conway County is our proximity to Pulaski County and Faulkner County. New cases yesterday, Pulaski County was number 1, Faulkner County is number 3. I'll bet many people in Conway County travel to Little Rock and Conway, and you're going to the number 1 and the number 3 highest counties in Arkansas for COVID. I would like to stress once again before I get into my special guest, just the importance of vaccination. I think there's so much misinformation out there. And as my guest last week implored, please get information from your personal doctor, not what you read on the internet. This is a pandemic of the unvaccinated. The statistics show right now that 98% of the deaths are in unvaccinated individuals. Like I said last week, you don't have to be a rocket scientist to figure that one out. The 2% that are dying that have been vaccinated are people with significant pre-existing health conditions, cancer, for example. That's just an example. So let me get into my special guest. Her name is Mrs. Koone Spivey, and Larry, if you'll pan over. I want to introduce Mrs. Spivey, and Koone, may I call you Koone?
Sure, yes.
I've known you since you were a little girl.
4 or 5, yeah.
So if you don't care, I'm going to
Not
call
at
you
all.
Koone on air.
Yes.
And before we get into some of the questions about your experience with COVID, may I have your permission to ask you about your medical history and your experience with COVID? If you feel uncomfortable with any question, just tell me and I'll retract it. But I'm going to try and limit this interview to your COVID experience.
Sure, absolutely.
Okay, good. Thank you. So a little personal history. And I hate to ask a lady her age, but
Don't mind, I'm 46.
Okay. And what is your profession?
So I'm a science teacher at Morrilton High School, and I teach 9th through 12th grade. So
Okay,
about
good.
14 and up.
Good. And how long have you been a teacher at Morrilton High School?
I've been a teacher for 24 years, but not the whole time at Morrilton. I was at UACCM part of the time. I've been at Morrilton majority of the time.
Okay, good. Now we're going to get into some medical questions. Okay. Do you have any tobacco use? Are you a smoker or a vapor?
Absolutely not.
Okay, good, good. And we'll talk about your experience with COVID. You got COVID back in December, is that correct?
December,
Okay.
yes.
What was your level of physical fitness, would you say, before you got COVID?
My husband and I walk, maybe not as much as we should, but we do try to walk 2 or 3 miles a day. We
Great.
occasionally go to his work, has a fitness center, and we'll go and do 30, 45 minutes of that. So I feel like I'm somewhat healthy.
Okay, good. Did you have any pre-existing health conditions? Diabetes?
No.
Blood pressure?
A little bit of high blood pressure. That just came with after I had kids.
Okay.
Well,
okay.
it started when I was pregnant with, but other than that, no.
Okay, so you're not a diabetic and you were physically fit. You were walking 2 to 3 miles a day and did not smoke or
Right,
vape?
I would say for my age, healthy, feeling good.
You really didn't have any risk factors for COVID other than exposure.
Right.
Do you know how you acquired COVID?
Well, it's one of 2 people. Of course, you can't pinpoint
Yeah, we don't
exactly,
wanna name
right?
anybody,
But someone I live with, my husband, he tested positive on December 13th. So that was a possibility, but at the same time, the school numbers were starting to be high, and I had several students who had tested positive, and as much as I tried to be not close to them, there were times I'm sure I would. So.
Sure. And you were masking at that time,
Yes,
right?
we were wearing our mask.
And I want to point out to the viewers that vaccines were not available for you or your husband back in December.
Right, correct. No vaccination yet.
Just out of curiosity, if the vaccine had been available, would you have taken it back then?
100%.
Okay, good.
I mean,
good.
as soon as it came out, we knew we were going to take the vaccine.
And you've been vaccinated since recovery from COVID?
Yes.
Okay, good. How sick did you get with COVID? I'm going to let you just run with this question.
Okay, well, like I said, Aaron tested positive on December 13th, and on the 14th, I went and had my test done, and I knew that day I was not feeling well. I knew I didn't feel myself, and I didn't get my test back till that Wednesday, but by Tuesday, I knew I had COVID. For me, it felt like someone had just knocked me down with a bat. No energy whatsoever. I started getting shortness of breath very quick, and that scared me most of all. That
Pretty frightening.
I couldn't get up off the couch, out of the bed, without going anywhere, without having to stop, and catch my breath. And I never I've never felt that way before. And so I was put on an inhaler, and I was horrible at it. I could not do it very well. And that helped some. My worst symptom I had was my headache. Besides every other symptom, I had them all. I had the cough, I had the congestion, but the headache for me was the worst. I mean, I thought my head was going to pop off. And I kept saying, I do not wish this on anybody. You know, like we said, I feel like I'm healthy, somewhat fit, and I just could not imagine ever feeling like that again. So I cannot imagine these people in hospitals and that are on ventilators, and it's a horrible.
Yeah. Now, you told me that you felt as if you were going to die at one point in time.
I did. On December 21st, I showed Dr. Koone a picture that I won't share with y'all, but I thought I was going to die. I thought, this is it. This is what death feels like. I'm going to die right here in this bed. And I didn't want to go to a hospital. I didn't want to risk infecting anyone, and probably didn't even feel like riding to the hospital with somebody. I just thought, you know, if this is it, this is it. But I didn't want anybody else to feel that way. You know, we were super careful. My son at the time, he's 14, and I don't know how he didn't get it. He rode in the car with me to get my test, and I mean, we didn't drink after each other. We wore our mask in the car. I remember that day we doubled up our mask, and he basically stayed in his bedroom for a 10-day period.
So he was out of school then.
He was. He missed school, and we'll talk about that in a little bit, but it's a struggle.
How many days did you miss work?
Well, luckily for me,
it was over Christmas break.
Right. So that
Merry
Christmas to me. So that last week, we have semester tests at the high school, and so luckily we had in policy an exemption policy, and because of COVID, we just were trying to get the kids, you know, out. And I did not have many students that week, but I missed the whole 5 days, and then of course Christmas break. So basically my Christmas break was recovering from COVID.
If this had been during the school year, how many weeks or days do you think you would have been out of school, out of your job?
Definitely 2 weeks. I mean, because at the time, you know, we were 10 days. Something that was scary to me is that on December 14th, I tested, and I remember calling our school nurse, and she said, "Curtsy, this means you were infected on December 9th, on Wednesday, December 9th. And I just, that hit. Who had I been around? Who could I possibly been in contact with? Aaron and I had bought a new car on December 12th. And we had to call the car place and tell the car salesman, we're sorry, but you know, Aaron has COVID.
And that's so important for people to realize, that the risk of transmission before you become symptomatic.
I felt so guilty. I had gone to a basketball game.
Oh, wow.
And had sat by a coworker. We, you know, wore our mask, but I just felt guilty even going, because I had no idea, not a single symptom at the time. And when she told me that, I thought, wow, I've been around 150 students since December 9th, trying to social distance, but it didn't always happen.
Sure, yeah. Well, are you back? Have you had any, did you completely get over it? Did you have any symptoms that lasted for a while, or recurrence of problems?
Well, just the shortness of breath, you know, for about a month, kind of stayed. I didn't do the inhaler, but I could just tell I would get tired very easily. And then after about a month, I did have a spell. It was at home. I stood up out of bed, and I literally just kind of passed out. I was getting ready to go to school, and I told Aaron, I said, I don't know what this is, but, you know, this scares me. I don't know if this is something from COVID. And I went to school that morning. I did not drive. I had a friend pick me up who lives in our neighborhood and was going to school as well. And as soon as I got to school, I did it again. So our school nurse came, took my blood pressure, which was super low, and I called the doctor, and they said that it's called post-COVID syndrome. and that it's very common, just like COVID, the side effects are different for everyone, but I had experienced it, and I did that 2 or 3 times.
Okay.
But since then, I've done well.
Have you resumed your walking?
Oh, yes.
Okay, good.
Absolutely, every night.
Good.
In the
Good,
heat.
Good. So let me get into some questions about school, and I want to stress to our viewers that Mrs. Spivey is just volunteering her personal opinions. This is not a school policy in any way. She's just speaking off the cuff and giving her own personal opinions. So Gertzie, what do you think about, are you familiar with Act 1022 that is going into effect today, that the legislature passed, that basically takes away the mask mandates, that for state agencies, offices, buildings, including schools, we can no longer require masks? Again, this is your personal opinion.
I had already decided prior to, with the numbers being as high as they are in Conway County and Arkansas, not looking good right now, my family's going to wear a mask. We're going to wear a mask.
Okay.
We go to the store, we're going to wear a mask. We go to school, we're going to wear a mask.
You're going to put your mask on in school?
Absolutely,
Even though you're a
100%.
COVID
Even though
survivor
I
and you've
am,
been
and I'm vaccinated, absolutely. I don't want it again.
Okay.
I don't want the Delta variant. I don't want anything of it.
Sure.
My son has been vaccinated. He will wear a mask, and he's fine with doing that.
Okay, good. Well, we had some questions from Larry that he submitted, and let me ask you some of Larry's questions, okay? Are the teachers reluctant to return to the classroom?
I haven't talked to a lot of teachers this summer, but I will just say from last year, there were a lot of times where we had breakdowns and you needed a really good support system, and there were definitely conversations made of how much longer can I do this? I may have to choose a different career. Just the stress level,
Sure.
got to all of us.
Yeah, you've been on the front line with teachers and students exposed to each other in large numbers every day.
Yes, every day.
Yeah. So another question from Larry. What about your teaching expectations this coming year? Do you think you're going to be able to teach your kids, get in full days, or how's this changed your expectations for school this year?
If you'd asked me that question in May, I would have probably have been the most positive person. We're going to get at it this year. We're going to have normal school. Now I'm very worried. We all learned a new term through this, Zooming. And even though I was putting stuff on the computer when my kids were quarantined, it was really important to me to actually see my students. And so I would encourage them to Zoom. I would ask other students, call this student, get them up out of bed, tell them to get on. They're going to Zoom with me today. We just tried to have school as normal as possible as we could. If you'd asked me 20 years ago, if I'd been teaching behind a screen, I would have probably have laughed, at that. But my expectation is just like last year. I'm going to do the best I can, and the ones that are quarantined, we're going to try to do as much as we can with them.
I have not only talking to teachers, but I have a sister that's a teacher in Perryville High School, and I know it was really tough on you teachers last year trying to teach whatever you could at school and then go home and do like another classroom
a video
with the virtual students who couldn't come to school.
I know. And giving them a Zoom time to get on and just begging and pleading. I just can remember trying to get parent numbers and friend numbers. Let's get these kids on. We've got to continue to have school.
Did you have any friends or teachers that just said, I'm hanging it up and left the teaching profession?
I don't think I did. We had a couple retire this year, but I don't think it was for that reason. Okay. We have really good departments, and I could not have done it without my science department. We took care of each other.
Good. One more question from Larry. From a teacher's viewpoint, how has this pandemic changed your students?
resilient to anything. I think they're very adaptable. They are very adaptable, and that just learning to learn behind a computer and do what they can do. I mean, it's.
Do you think the virtual learning was as good as in classroom learning?
No.
Okay.
I do not. I think it was a substitute. Just like when you have a substitute teacher that has to come into your classroom, you hope that they can do the best they can. And I'm thankful we did have virtual, and we could try to keep up with our kids, keep up with class and school. But I don't want to see it. This is the new school way.
Sure. Sure.
I just don't.
Yeah.
Our kids need to see us. They need to be with us. They need those hugs.
So how do you think we're going to get back to some normalcy? What's your take-home message?
100% please get vaccinated. If you can get vaccinated, if you are the right age, please get vaccinated. Stop listening, stop reading things on social media. Talk to your doctors, talk to your pharmacists, talk to your friend that had COVID and didn't get vaccinated. Talk to people who are on the front line of this pandemic right now. I mean, we all know somebody who's probably in the medical field, whether it be a nurse, a doctor, and they're struggling. They are struggling, and we've got to get vaccinated.
Yeah.
Everybody. My students are at an age they can be vaccinated, and I don't know how much personal-wise I can push that on them, but if I see them out in public right now, I'm gonna encourage it.
Well, good for you. Well, Kurtzy, you've been very good about coming on for us and sharing your viewpoints. I'm sorry you got sick with COVID. I wish you'd had a chance to get vaccinated before December, but it just didn't happen for your age group.
You think, I won't get it. I won't get it. I don't think I had that mindset because I was taking all the precautions. It just happened, and.
Well, I'm glad you and Aaron recovered.
Absolutely,
and back to
yes,
normal, and
we are.
your son didn't get it.
No, I'm so thankful for that.
And
because he was quarantined 3 times at school this year.
Oh wow!
3 different times, and there we'd go again. Back to behind the computer.
I'm concerned about the Delta variant. If there are no mandates for masks, if some of the kids are not getting vaccinated. If with this Delta being so contagious and transmissible, if one kid in a classroom gets it, I think you're going to send all 20 kids home for quarantine for 2 weeks.
Wow. So, I mean, do you think we'll play on the whole 6 feet thing again if you were within 6 feet, or this is more serious?
I'm going to defer to CDC and the Arkansas Department of Health, but I suspect somebody's going to be pushing really hard for return to masks and 6 feet social distancing. I really think so.
It's hard in the classroom sometimes. Very hard.
Well, Kurtzy, I want to thank you for coming on.
Thank you for having me.
Well,
absolutely.
You're most welcome.
Got to get these
for sharing
people vaccinated.
Right. Thank you for sharing your story, and I'm so glad you and your family are better. And
we are.
Appreciate one more time you coming on with us.
Thank you. Thank you for having me.
Thank you, Larry. Conway County, hope you take this message to heart. Mrs. Spivey is my second guest that I've had in the last week, and if this is well received, I'll try and come up with some more guests for you to hear a personal story on their experience with COVID. Okay, thanks and have a good day, and please consider your vaccination. Take care. Bye-bye.